The sample history. The sample history is a mnemonic that technicians use to elicit a patient's history during the early phases of the patient assessment. It's common for tech personnel to use mnemonics and acronyms as simple memory cues. These help healthcare personnel remember the order of medical assessments and treatments. The sample history can be used by medical personnel during any patient assessment. It will usually begin after the ABCs and primary survey is complete. Also, if the primary survey indicates any life threats, those need to be treated before performing a sample history. For example, any airway, breathing, circulation, or severe bleeding issues need to be treated before attempting to elicit answers to sample history questions. What does SAMPLE stand for? S, signs and symptoms. A, allergies. M, medications. P, pertinent medical history. L, last oral intake. E, events leading to present illness. The sample history allows EMTs to gather information related to the chief complaint in a quick, efficient manner, which is not only beneficial to the tech, but also to hospital staff once the patient is dropped off. In a trauma, this is the mechanism of injury, and in a medical patient, it's the nature of illness. Taking a good sample history can help you find out whether the patient became unconscious due to a fall or fell due to losing consciousness. It can help determine the cause of the patient's complaints and anticipate possible complications in the near future. Remember, EMTs document all the information taken during the sample history and then verbally report important details to the staff at receiving facilities. This means taking an accurate history can make the patient experience go more smoothly. When taking a sample history after completing the OPQRST assessment, the healthcare personnel should already have determined the signs and symptoms relating to the history of present illness. You can ask clarifying questions about the associated signs and symptoms related to OPQRST. Because of this, the patient assessment following OPQRST becomes the ample mnemonic instead of the sample mnemonic. Basically, this means that during a medical assessment, if you have a patient with chest pain, you will do OPQRST and then move on to the AMPLE mnemonic. Sample assessment. Signs and symptoms. During this portion of the sample history assessment, healthcare personnel will try to determine exactly what the current patient complaint is. Sometimes patients will verbalize one complaint, but their real issue is something different. For example, the patient or bystanders may say the patient has slurred speech and erratic behavior, but healthcare personnel will need to figure out if it's from alcohol intoxication or if it's caused by a neurological issue like a stroke. A sign is a measurable or observable findings that the tech can witness. Some examples of signs are bruising, vomiting, hives, pale skin, blood pressure, heart rate, and respiratory rate. A symptom is the patient's experience of their illness or injury and can be measured by the EMT. Symptoms are subjective descriptions from the patient to the EMT and include nausea, fatigue, numbness, and lightheadedness. It's important to ask the patient questions like, "Why did you call today?" or "What's wrong?" rather than "What are your signs and symptoms?" A stands for allergies. The goal of this portion of the sample history is to determine whether the patient has any allergies. The tech will ask questions like, "Do you have any allergies? Are you allergic to any foods, medications, contrast, or anything else? Do you have any allergies we should know about?" It's also a good idea to find out whether the patient has a local or systemic allergic reaction to the allergen. You can do this by asking them, "What happens when you are exposed to the allergen?" Medications. During this part of the sample history assessment, the EMT will find out if the patient is taking any medications. Unfortunately, asking the patient, "Are you taking any medications?" won't always get the tech a complete answer. Therefore, asking, "Are you prescribed any other medications?" and "Have you taken any medications today?" can help you get more accurate information during the patient assessment. Patients often forget medications or get distracted while answering, so continue asking about medications until you have them all. Following up with "What other medications do you take?" is always good for your patient assessment until you record them all. This also gives patients a moment to think of anything else they may have forgotten. The EMT will use this part of the sample history, or the P for past pertinent history, to figure out the patient's past medical history and decide if there are any conditions affecting the patient's chief complaint. This part of the sample history can be a little tricky. The EMT has a limited medical knowledge, which means that they can't always decide what past issues are pertinent to the current complaint. For this reason, it's better to record more of the patient's history than less if you aren't sure. Fortunately, some of this information will already be recorded during the allergies and medication portion of the sample patient assessment. After all, if your patient is taking a blood pressure medication, you'll ask them if it's for high blood pressure. Here are some examples of questions the healthcare personnel can ask during the P portion of the sample history. Do you have any medical conditions I should know about? Have you ever had this happen before? Have you ever been admitted to the hospital or had any surgeries? Have you had any illness or infection recently? Last, oral intake. During this part of the sample history, the EMT will try to determine if the patient's intake and output is the cause of or is being affected by the chief complaint. This is done by finding out when and what the patient last ate and drank. Asking about the patient's eating and drinking history may not sound very important. However, if you get in the habit of doing it, you'll notice that it reveals a lot about your patient. The L portion of the sample history can give the technician a clear picture of the patient's lifestyle for the last 24 to 48 hours. This is important because some patients are poor historians. For example, a patient may tell you he began feeling ill 2 hours ago, then during the oral intake questioning says he hasn't eaten much for the last 2 days because he has been too nauseous. Last oral intake becomes especially important for patients with diabetes and gastrointestinal complaints. In fact, for GI patients, the EMTs should include questions about the patient's output, including bowel movements and urine. Some common questions the EMT can ask during the L portion of the sample history are: have you been eating and drinking like normal? What has stopped you from eating normally? And for how long? When did you last have something to eat and drink? And what was it? Events leading to present illness or injury. The last part of the sample history is meant to determine what was going on when the patient began experiencing their current medical illness or injury. The tech can hear the patient explain what was going on at the time of the incident or illness. At this point, the tech should be able to determine whether the events leading up to the current illness or injury were sudden or gradual. Some of the questions that can ask during the final part of the sample history include: what happened? What were you doing when this happened? And how did you get hurt? The sample history taken is a proven technique for healthcare providers. Practice and experience can help master the sample history and learn to elicit the information you need from the patient in a comfortable tone of a conversation.